This is the implications of aging in elderly populations for neuraxial anesthesia. There are a few anatomic changes that are seen with aging. Older people have decreased neurons in the central and peripheral nervous system. They have a breakdown of connective tissue. They have increased dura permeability, possibly due to enlarged arachnoid villi. This leads to faster onset and higher dermatome levels after a block. They also have decreased CSF volume. There's decreased fatty tissue in the epidural space, decreased beta-receptor affinity, which means that your test dose with epinephrine may have a reduced or delayed response. The intervertebral foramen is narrower and more sclerotic and calcified. The injectate can't spread, which means you have a faster onset. The epidural space has an increased compliance and decreased resistance, which means that you have increased spread of local anesthetic. There's deterioration of the myelin sheath, which leads to slower neural conduction, which has more implications for peripheral blocks. There are other clinical changes observed in the elderly. They tend to have an increased intensity of motor blockade with ropivacaine and bupivacaine. They're more susceptible to sympathetic blocks and reduced systemic vascular resistance, which means they have a high risk for hypotension and oftentimes require a fluid bolus and vasopressors.